Hi guys, welcome back to PLAB Made Easy. My name is Ashish and I'm a junior doctor working in the UK. In today's video, I want to talk about my experience while I was working as a junior doctor in the Department of General Surgery. So I'll be describing a regular day in my life while I was working as a junior doctor there. So let's start. I woke up at 7:30 a.m. every morning and I used to get ready for work, make coffee and cook breakfast, which usually consisted of oats and milk or an egg omelette. I used to reach hospital by 8:30 a.m. and my day started with a morning handover meeting. This is a meeting where all admitted cases are discussed by the previous day's on-call doctor and the night on-call doctor. So for a patient to be admitted in an NHS hospital, they either come through A&E, which is the Accidents and Emergency Department, or they are referred by their general practitioner to the hospital, and that's how they get admitted to the hospital. And all these patients are discussed in the morning handover meeting. At 9 a.m., when the morning handover meeting used to get over, I used to prepare a list of all the admitted ward patients under my team, and I used to print them for all the members of the team, which consisted of FY1 doctor, which is foundation year 1, FY2 doctor, which is foundation year 2, or a junior doctor, which was me, the surgical registrar, which is the middle grade doctor in the team, and the consultant. We used to finish the ward round by 10:30 a.m. and by this time we had accumulated all the jobs which are meant to be done for the patients. So I used to update my patient list with the jobs which were needed to be done. These jobs were distributed between me and the other junior doctor, which is the FY1 doctor. The middle grade doctor or the registrar was usually busy in the clinics or theatre, but they were easily approachable if you needed any help. I used to grab a quick cup of coffee at this time before I started on my day's jobs. By 12:30 p.m. I used to finish about half of my day's jobs. These jobs used to include taking bloods if the phlebotomists couldn't take them, chasing blood results and acting on them, contacting other departments for referrals if needed, speaking to the relative of patients, speaking to microbiology consultant on call if there were any antibiotic changes which were needed to be done, speaking with hematology consultant on call for optimizing patients' anticoagulation status if needed, assisting in the theatre with the registrar or the consultant if there was an operating list, and managing acute patients in the wards if any problems arise, such as alarming changes in patients' vitals or any temperature spikes. So those were the jobs which were needed to be done. At 1 p.m. I used to go for my lunch break, and either I used to cook my lunch and bring it to the hospital, or I used to eat from the hospital cafeteria or Costa Coffee. I tried to finish all of my day jobs by 4:15 p.m. and if there were any leftover jobs, those were handed over to the on-call doctor for the day, and the on-call doctor was notified about any jobs that were needed to be done at a particular time as well, such as taking pre-dose gentamicin level for patients before giving them their daily doses of gentamicin, and we also used to notify the on-call doctor about any acutely unwell patients in the wards. So that used to be done by 4:15 p.m. By 4:30 p.m. I used to update my patient list, and I used to finish my shift and I headed over to home. So that was a regular non-on-call day for me while I was working as a junior doctor in the Department of Surgery. Apart from all of that, we used to have one day of the week where there was a surgical teaching session conducted by one of the doctors. This doctor was one from your team, or it could be you, so you had to prepare a presentation and present there. There were also teaching sessions from 12 to 1 p.m. 2 to 3 days a week for junior doctors, and they used to cover different kind of topics ranging from clinical medicine to communication skills to practical skills, and these were really good sessions. Also, if I used to find some time between my ward work, I used to complete my ongoing audits or research projects, and that's how I used to work as a junior doctor in the Department of General Surgery. That is all for this video. If you want to support my work on YouTube and see similar videos, you can do so by clicking on the like button. You can share this video with your friends and colleagues, and you can subscribe to this channel. Thanks a lot for watching this video, and I'll see you soon.